Another possible need for adjustment of a custom functional foot orthoses is the heel cup. Occasionally the heel cup will dig into the patient's heel and create skin irritation, usually at the lateral margin. This is a little more challenging than adjusting the arch of the orthosis. We will often prescribe an orthosis with a deep heel cup to get better control compared to a standard heel cup you see here. The deeper heel cup, though, does run the risk of shoe fit challenge, as well as possibly irritating the fat pad around the calcaneus. So we may have to adjust it. Now, the common strategy for doctors is to either ask the lab to grind down the heel cup, grind the edge, or they will try to grind it themselves in the office. Invariably, that does not solve the problem. And the reason is, if we carefully look at the shape of this orthosis, which is typical for most, you will notice that it's wider at the top than it is at the bottom. So as we grind down and make the heel cup lower, we are effectively narrowing the heel cup. So we're not going to solve the skin irritation. What we want to do is make the heel cup wider, and you can't make it wider by grinding. That's not to say that perhaps beveling the little edge of the orthosis at the heel might help, but it's usually not going to be that effective. And then you start to lose the control that you prescribed the orthosis for in the first place. So what we really want to do is we want to bend this heel cup out only at the area where it's irritating the patient. So again, we would mark the orthosis with a small piece of tape or a felt pen, and then we would go ahead and heat the device so that we can bend it. Now, once it's heated, we can bend it either with pliers, or we can put on gloves, which is not a bad idea, and try to work it out just with manual traction. It's very easy, as I showed earlier, to adjust a composite graphite orthosis. And in that case, I really prefer using the pliers. But polypropylene is a little harder to heat adjust, especially when there's a post on. What we're afraid of doing when we heat this is the post can lose its adhesive to the device. So it's a little bit more risky, but it can be done if you do it very gently and very carefully. The downside of the pliers is they can leave an indent or leave a mark on the device, which is cosmetically unsightly. It really doesn't create a problem for the orthotic. Could create a problem for the patient just with their perception. But let's go ahead and spot heat, and let's try to make this device wider in the heel. Now, again, we try to use the left orthotic as a reference. You'll notice that these heel cups are perfectly the same height. So this is a really well-made pair of orthoses. But for some reason, this pair is irritating the lateral heel. So we're going to focus the spot heating right there. You'll notice I did a pretty wide area here because in most cases you really want to expand a fairly substantial part of the radius. So watch how easy and how pliable this is with pliers to just bend this out. Very easy with the composite. Or you can use your thumb. See how it's very pliable and forgiving at this heated state. And in this case, I don't think there's a big risk with over expanding, except for perhaps the shoe fit. I think you want to visibly see that heel cup go out a little wider. Sometimes you can match it up with the previous one and see if it's actually gotten wider. But normally you'll see it become just a little flatter, and then you go ahead and run that under cold water. That'll freeze that correction right where you left it. Take it in the treatment room, let the patient try it on. Normally they'll feel the improvement right away. When we try to adjust the polypropylene, it's a little more challenging, simply because we have to heat it longer. And if there's a rear foot post on, which usually there is, you don't want to overheat or that post may fall off. So we have to be a little more patient here. So we wait till it gets shiny. We clamp the pliers on about at the point of maximal irritation, and we just drop it down in little increments. And you'll see it getting wider. The problem is there's a tendency for this heel cup to spring right back where it was. So in this case, we might start with the pliers and then get a glove on and just put your thumb right about where the maximal area of irritation was, push down and hold it for about 30 seconds until it cools off. I wouldn't run it under water right away because you're going to lose that correction. I would go ahead and hold the correction with your thumb until you feel and see the device cooling off. The shiny surface begins to change texture. And it's interesting, with the rear foot post on, there's just more resistance here to the adjustment. It's just harder to get that polypropylene to give way. And so this one you may have to be a little more patient on. It may require multiple attempts at widening, but the key is not to overdo it on the first try because you could lose the rear foot post. So I'm looking down on that, and we've definitely flattened this in a way that it should end up being comfortable for the patient. We're going to go ahead and run that under cold water, and then we'll have the patient try it out. Hopefully they'll tell you it feels comfortable. We'll have a happy patient.